Hey, folks, this is Andrew here. I am on almost 3 weeks after surgery. I'm on day 20 post-operation right now, and thought I would record a little video update. I meant to do one of these after my 14-day follow-up with the doctor, but then I just got busy having returned to work and I forgot. But I'm here a little bit early today for my second PT session. I came out to just get a little coffee. Figured while I was hanging here waiting on things to start, I'd just go ahead and give an update because things have progressed a good bit. This recovery is long and it's slow from a hip arthroscopy. I have mentally managed that by setting milestones for myself in my mind, either dates that we're going to work towards or certain goals in terms of recovery. I've met two of them now. First one was make it to the 14-day post-surgical review with the doctor, and second was to start physical therapy. I had the post-surgery review 14 days or 15 days after surgery. Your miles may vary depending on your doctor, your protocol. It may be a couple days after or 2 weeks like mine. Overall, the review went well. The doctor took some x-rays to kind of examine the bone, how it's developing and how the repair looks. He says that everything looks good. I got the stitches removed, the external sutures, and I've gotten released to do a little bit more physical activity, some removal of restrictions of range of motion. I've been cleared to go back to the gym and start doing some light upper body resistance type training and exercise. And I started PT a few days after that. So things that have gone well so far include just general progress. I've had a rather, I would say, a linear recovery thus far, and I'm pleasantly surprised by that because in reading and learning about other people's experiences recovering from this surgery, most people say that the recovery is not linear. That may change for me as I start to ramp things up in the PT. Here in a couple of days when I can start adding some weight back on to my left side, I anticipate I'm going to start feeling a little bit of soreness as we add back physical activity. That thus far has not been the case, and that's been good. The stiffness is going down a little bit at a time each day. It sometimes seems like it's a little slow, but if I think back to 2.5 weeks ago, I got a lot more mobility in my leg, ability to flex it up to 90 degrees without stiffness or pain. The doctor gave me some additional exercises with hip abduction and adduction, that's opening and closing of the hip, removed some of my movement restrictions there. Got a few more things to do as part of my PT at home every day, and so that's good. A couple of tough things. Number one, just getting up and around sometimes is a little bit of a challenge. Do not ever try to drag a full trash can down your driveway on crutches. I learned that the hard way. It doesn't end well. Get help with those things. I'm also going to have to go on some antibiotics because my surgical incision site is getting a little bit infected. Those things tend to happen when I got the stitches removed. Everything was really red and puffy, which is not unusual. The doctor wrote me an antibiotic prescription, and he told me to wait 24 hours after the sutures came out and see if the redness and the puffiness went down any. It actually went down a good bit, so I picked up the prescription, but I didn't start taking the pills because the doctor said if it goes down, you may not need the antibiotic. But when I got to physical therapy a few days later, the therapist looked at the incision site and said, yeah, you probably need to reach back out to your doctor's office because that still looks a little concerning. I did. I sent the doctor some images, and his office came back and said, yeah, you need to start taking those antibiotics. Unfortunately, I'm an idiot, and I've lost the pill, so had to message them again this morning and ask them if I could get another prescription. That's going to be probably a 10-day cycle of medication. That means that will delay any ability to get the wound wet in like a bath or returning to swimming. That's unfortunate. I was looking forward. One of my milestones is when I can get back in the pool. I'm a triathlete. I love to do triathlon. You see here, Ironman. If I can get back to swimming, that'll be great. But that's unfortunately just going to be put off for a few more weeks. And asking around with other people who've had this operation done, I heard as soon as 3 weeks and as long as 6 weeks after having the operation, when the wounds are healed up and you can immerse the wound site in water and return to swimming. Looks like I'm going to be on the higher end of that, and that's okay. This is not something that can be rushed. The recovery's long and slow. You just got to let it progress as it does and heal up. And that's really been the biggest challenge, is not pushing things. I mean, I feel like right now, like I could just throw these crutches out and start walking and maybe go for a run, which would not be good. That's good in that my pain has been minimal. I've just had a few aches, mostly stiffness, and which loosens up when I do the exercises. I'm actually pleasantly surprised at how mobile I am. I've had a few people who've come to see me say that they're a little bit taken aback as how easily I'm able to get up and get around, because nothing hurts. But it's just got to give the joint rest, because that's traumatic to the body, opening up the hip capsule, cutting into there, putting in sharp instruments. Got to give it time to heal and recover. The physical therapist that I'm using here at Emory is someone who has a lot of experience in working with these type of injuries. She's athletic, and her husband is actually a triathlete and an ultramarathoner, a triathlete like me, and he's also run a lot of long distance runs like the Leadville 100 trail race, 100-mile trail race. So she is very familiar with this kind of attitude, the desire to just get out there and get going and push. She said to me in our first session, you have got to do what I say. You've got to follow the protocol. You cannot push until I tell you to. So that's what we're going to do. I'm keeping my eye on the prize of being able to returning to running, to returning to triathlon. I'm about to go into my second session here. Thus far, the PT has been primarily additional minor stretching and minor passive movement type exercises, similar to the ones that I've shown before in video, but just adding some more stretches and then opening up the hip just a little bit more. From what I understand from the plan, is it's just going to be progressively adding such things. And tomorrow I can start adding 50% weight bearing on my left side. Yay, I'm happy about that. My right glute is going to be really, really happy to not have to bear all of the weight. You're walking around on crutches, you're going to experience some compensation type issues. I've had a tight right glute, that's the non-operated side, because it's just having to carry all the weight. That's just how it is. But with the stretching and the physical therapy, that'll all get worked out. Some things that I hear people ask is how easy is it to get up and around? If you define hobbling around the house, that no problem at all. Carrying things, that's a whole other story. Got to use your bags. If you have a job that requires you to be on your feet, you're probably looking at being off for 3 to 4 months until you can return to being on your feet full time. I fortunately have a desk job that I can do from my house. I came back to work after about a week and a half working from home. I still have to be flexible, as my coworkers be flexible with me to give me time to go ice and stretch and rest when I need it. That's one of the things to take into consideration when you think about whether or not you're going to get this surgery, is the downtime. For somebody who's working a physical job, that's a lot of time off. When getting a physical therapist, you definitely want to get someone who's experienced in working these types of injuries and working the specific rehab for this surgery. I had my surgery done here at Emory in Atlanta, and I'm at the Emory, the Hawks Center, the rehab center for the Atlanta Hawks basketball team. Really swank place. Since they're part of the same facility, they all know each other. I asked the surgeon's office beforehand who they would recommend down here if they have specific physical therapists that they like to use, and they said yes, they have people that are very familiar with hip arthroscopy and the recovery protocols. That's not always going to be the case, so definitely plan your physical therapy beforehand. Find the center, get a good one recommended who has experience working with helping recover from a hip arthroscopy. But here we go. We're about to go in and get stretched and get iced a little bit. Get some more exercises added. I'm thinking that maybe they might get me on a stationary bike today. That's what they were saying last time. It's going to be gradually adding one new factor at a time. When talking with the physical therapist about new things that I can do, she said, I asked about changing my gait a little bit, because right now I got to walk left foot forward and the right foot up even with it, and the left and the right like that, which taking those little short steps is kind of a pain in the butt. But the reason for that is you don't want to open up the hip too much. I asked her if I could modify my gait, and she said, no, you need to wait, because you've introduced physical therapy now, and that is one element. You want to do one element at a time. Perhaps I'll be able to modify my gait a little bit, or perhaps she'll say no, because if tomorrow I'm starting to add weight back on, then that is another variable as well. But it's all gone all right. It's slow. It is what it is. We're going to get back in there, do a few exercises, and I'll do some further updates with some other things that I've just learned about this surgery and recovering for it in the coming days. But other than that, thanks for watching, and good luck in your own recovery. Cheers.